Okay, so welcome to this Module 2B lecture on the ethical principles in caregiving. By way of introduction, ethics are a system of moral principles that help people decide what is right and what is wrong. It will also help decide how to treat others fairly and with respect. Ethics are also known as moral philosophy, and they're important in both personal and professional life. They can help people make decisions that have positive impact on the society and others. Ethics can involve examining one's own standard to ensure that they are reasonable. It can also involve studying one's own moral beliefs and conduct. And it can involve striving to live up to reasonable standards. So now, for every contact, for every caregiving, for every interaction you would have with a client, it's important to ask these questions to be sure that one is not flaunting ethics in any way. So the first question will be whatever it is you are doing or you have done for the patient, or whatever interaction, conversation, decisions you make concerning the care of your patient. If you ask yourself the question of, would I be happy for this decision to be in the news tomorrow? If you can answer a resounding yes, chances are you may be doing something that is ethical. And the other question is there an ethical, non-negotiable decision at play in this situation? I'll still come to discuss the ethics in subsequent slides. And the third question is that, will my action today, this action I'm taking as regards the care of this patient of mine, will it make the world a better place? If you can answer yes to these questions every single time, you can assume that you are ethically correct in most situations. So then, what are the ethical principles that will guide the profession of caregiving? The first one is beneficence. Beneficence means the principle of doing good for others. And that just means helping your clients meet their needs. Whatever decision, whatever help it is you choose to render to the client, it should be that the sole aim is to do good unto such a patient. The second ethical principle is non-malfeasance. It just means not doing bad. Whatever decision you would also do or take, or any action you will carry as regards the care of your patient, should not negate the well-being of such a patient. The third ethical principle is autonomy. Autonomy means your patient reserves the right to accept or decline any form of treatment or intervention you may want to implement. So the patient reserves a right to self-determination, and such a right should be respected. The patient says, no, I do not want to have my medications now, after you've done all the counseling and advice that you know how to do. You put it in the documentation that medications was declined at so and so time on so and so date, and then you go ahead to inform your supervisor. Justice is the principle of treating all people equally and equitably, so that one of the elderly patients you're privileged to care for is a relative does not mean that the individual will get a preferential treatment if they are all within the same nursing home. Everybody gets the same type of treatment implemented without giving undue favoritism to any patient or any client. That explains the principle of justice. Fidelity is keeping to your promise. And that would also mean that the caregiver will take extra caution in making promises. So if you say you're going to be there by 2, do all you can to be there by 2. Otherwise, don't make promises that would put you at risk of flaunting the ethical principle of fidelity. Veracity is the principle of telling the truth. Now in healthcare, a number of truths are oftentimes very bitter. Like you need to change a wound dressing, and the patient asks you, will it be painful? Of course, it's going to be painful. Telling the patient, don't worry, you won't feel any pain. That is not veracity. That is the opposite of that. Or saying it in a way that more pliable, more a bit kinder. Okay, you will feel a bit of pain, but I'll be gentle with it. That is more like it. So you're telling the truth, but you're telling it with kindness. But that would also require caution, not to just blot out some truths. Absolutely. So there are ways you can still put soft edges around it without lying. Then informed consent is the basis for autonomy. You know, we discussed autonomy earlier, meaning the patient reserves the sole right to say yes or no to any form of treatment or intervention. Now, informed consent is the basis for autonomy, truth-telling, and confidentiality. So your patient tells you, you've explained this is what we want to do. It's going to be painful, but we'll be gentle for it not to be painful. And the patient understands the details of what your intervention will entail. And he or she declines and says no. That is an informed consent. And if the patient says yes, having understood or the nitty-gritty of what you plan to do and how discomforting or comforting, whatever the case may be, to them, and the patient still says, go ahead, that will be counted as informed consent. That being said, you shouldn't carry out procedures on a conscious patient without ab initio asking and taking informed consent. So that could even be you want to take the patient's blood pressure. So, Sama, I'm going to take your blood pressure reading now. Is it all right with you? Can I go ahead before you begin to wrap the cuff on the patient's forearm? Not that you just take the hand and you wrap the cuff and go ahead without communicating your intentions or whatever intervention you want to carry out on the patient. Now, ethics of care, the principles related to the origin of care relations, the obligation to care, and the scope of care distribution. That is what I just discussed. And there are some other principles of caregiving that we will not call them ethics, but they are still principles. Ethics essentially are things that can make you legally liable. The other principles, while they're still important, may not be as succinct as ethical considerations are. So some other principles are, it's important to respect the care receiver's lifestyle. So whatever lifestyle your client chooses to live, it's not really your place to counteract or give a dissenting opinion to such a lifestyle or their culture or their values. You give respect to it. Your work there is as a caregiver to give both the physical, psychological, health support that they need, nothing more. Not to interfere in the decisions that they make concerning lifestyle, culture, values, and the like. Another principle is helping the care receiver become more independent. That's your goal, not to make them dependent on you. So for every intervention, you should be able to answer the question that this is good, is moving my clients closer to becoming independent. Then prioritizing prevention to reduce the amount of care required. So prevention is the key. So a lot of things can be prevented. Anti-slip rug can be placed on the floor to prevent your patients from having a slip and then having a fall and then having a fracture. So many things can be prevented. Food hygiene can be employed to prevent your patient from getting infected and then falling sick and then needing more care. So prioritizing prevention is essential. Then another principle that is important is respecting the caregiver's choices, care receiver's choices. If patient says no, please respect it. Says yes, please respect it as well. It's also important for you as a caregiver to be reliable and considerate. It's important to cooperate with team members because I said earlier, the home care team is a team of a number of persons. It's not a one-man show. So as a caregiver, you should be a team player such that the patient's care goes smoothly. Then it's important to be efficient with time and supplies. Don't waste time, don't waste supplies. And follow procedures to the letter. Then it's important to wear appropriate, neat and clean clothing as a caregiver. Then it's also important to leave your personal problems at home. You're here to offer care to the client, not the other way. So if you have personal issues going on at home, you leave it at home And when you're at work, you're at work, and then when you get home, you may decide to pick it up as the case may be. So keeping this in mind will allow you to really be an effective and a safe caregiver. Thank you very much.